5 health checkups you should avoid after 70 that may harm you more than help. Vertical bar senior health tips. Aging brings wisdom, experience, and a greater appreciation for health. After 70, many seniors dedicate more attention to regular checkups and screenings, hoping to catch illnesses early and extend their quality of life. While preventive care is important, there is a hidden truth that often goes unnoticed. Not all medical tests are beneficial in advanced age. In fact, some common screenings and procedures may bring more harm than good for seniors past 70. Modern medicine has made remarkable progress in diagnosing and treating diseases, yet it sometimes forgets that every test comes with risks: radiation exposure, false positives, invasive procedures, and unnecessary anxiety. For older adults, these risks can outweigh the potential benefits. A test that once made sense in the 40s, 50s, or even 60s may no longer be appropriate after 70 because the body responds differently and life expectancy changes the balance between benefits and harms. This article explores 5 health checkups seniors should think twice about after 70, explaining why they may be more harmful than helpful, and offering healthier alternatives to maintain well-being without unnecessary interventions. 1. Colon cancer screenings. Colonoscopy is one of the most commonly recommended cancer screenings. Doctors often encourage adults over 50 to undergo the test every 10 years to detect polyps and remove them before they turn cancerous. While this has saved countless lives, the situation changes significantly after 70. By the 7th decade of life, the growth rate of polyps slows, and the risk of developing aggressive colon cancer decreases for many individuals. Meanwhile, the risks of colonoscopy itself become more dangerous. Sedation complications, internal bleeding, and even intestinal perforations are far more common in older patients. Recovery from these complications can be lengthy and, in some cases, life-threatening. False positives are another concern. A harmless polyp may lead to more invasive procedures or even unnecessary surgery. When weighed against the relatively slow progression of colon cancer in most seniors, the test may expose individuals to stress and procedures that will not meaningfully extend their life. Healthier alternative. After 70, stool-based tests, such as the fecal immunochemical test FIT or a simple fecal occult blood test FOBT, may offer a safer option for checking colon health without the risks of invasive procedures. Focusing on diet, hydration, and fiber intake can also protect digestive health naturally. 2. Prostate cancer screening PSA blood test. Prostate cancer screening through the prostate-specific antigen PSA test has been widely promoted for decades. However, after 70, its value becomes questionable. PSA tests are notorious for false positives, leading to a cascade of unnecessary biopsies, radiation treatments, or surgeries. These interventions often cause severe side effects, including urinary incontinence, erectile dysfunction, and chronic pain. The reality is that prostate cancer in older men usually grows very slowly. In many cases, seniors will live the rest of their lives without the disease ever causing symptoms. Detecting and aggressively treating it may cause more harm than letting it be. Instead of extending life, unnecessary treatment can diminish its quality. Healthier alternative. Instead of routine PSA screening, older men can focus on overall urological health. Staying hydrated, maintaining a balanced diet rich in zinc and antioxidants, and monitoring for real symptoms like difficulty urinating or unexplained pain are more meaningful approaches. 3. Mammograms for breast cancer. For women, breast cancer screening through mammograms is a common recommendation. While mammography has saved lives in younger age groups, its benefit beyond 70 becomes much less clear. Studies show that mammograms in older women often detect very slow-growing cancers that would never have caused harm during their lifetime. The danger lies in overdiagnosis. A detected tumor can trigger a chain of events: biopsies, chemotherapy, radiation, or surgery. These treatments are exhausting and often carry long-term complications that outweigh the actual risk posed by the cancer itself. The stress of frequent screenings and waiting for test results can also negatively impact mental health, particularly for seniors already managing multiple chronic conditions. Radiation exposure, though low in each test, accumulates over time. For someone beyond 70, the potential benefit of catching an aggressive cancer is often outweighed by the immediate and long-term risks of repeated exposure. Healthier alternative. After 70, breast health can be monitored more effectively through self-awareness and physical examinations during routine doctor visits. Paying attention to changes in breast tissue, unexplained pain, or skin alterations can be more beneficial than relying on mammograms that might spark unnecessary treatment. 4. Lung cancer screenings, CT scans, and X-rays. Low-dose CT scans and chest X-rays are sometimes recommended for older adults, particularly those with a history of smoking. At first glance, this seems like a reasonable precaution. However, after 70, the risks start to outweigh the rewards. CT scans expose the body to significant radiation. For seniors whose cells are already more vulnerable to damage, this exposure may increase the likelihood of new health problems. In addition, these scans frequently pick up non-cancerous abnormalities, leading to invasive follow-up tests, surgeries, or even chemotherapy that may never have been necessary. Seniors with other chronic health conditions, heart disease, diabetes, or respiratory problems are especially vulnerable to complications from invasive lung procedures. A diagnosis of a slow-growing tumor that would not have affected lifespan can quickly spiral into aggressive treatments that drain both energy and resources. Healthier alternative. The best approach is focusing on lung health maintenance. Seniors should prioritize breathing exercises, regular physical activity, avoiding smoking and polluted environments, and eating antioxidant-rich foods to support respiratory strength. A doctor should only consider imaging tests if severe, unexplained symptoms like persistent coughing or sudden weight loss arise. 5. Bone density scans. Osteoporosis is a genuine concern for seniors as weakened bones increase the risk of fractures. Bone density scans, such as the dual energy X-ray absorptiometry DXA, are often used to measure bone strength. While a single test in the early senior years can be useful, repeated scans after 70 are rarely necessary and may sometimes cause more confusion than clarity. Bone density changes very slowly with age. Repeating DXA scans every year or two exposes seniors to unnecessary radiation and medical expenses without providing meaningful new information. Worse, minor changes in scan results often lead to overprescription of medications, many of which carry harmful side effects like digestive problems, kidney damage, or unusual fractures. Instead of focusing excessively on numbers from a scan, seniors can protect bone health through lifestyle adjustments that are far more effective than repeated testing. Healthier alternative. Adequate calcium and vitamin D intake, resistance training, balance exercises, and fall prevention strategies are the most powerful ways to maintain bone strength. A single baseline scan in the early 70s may be sufficient, with treatment decisions based on real symptoms rather than minor fluctuations in test results. Why some tests become harmful after 70? The 5 checkups above are not inherently dangerous. They simply lose their effectiveness as people age. A test designed to detect disease early must always be judged against life expectancy, quality of life, and the risks it carries. For someone in their 40s or 50s, a positive result may lead to decades of healthier living. But after 70, aggressive treatments often reduce quality of life more than the disease itself would have. Another reason is that the human body becomes less resilient to invasive procedures, radiation, and harsh medications in advanced age. Recovery slows, complications increase, and the emotional toll of constant testing can lead to anxiety and depression. Seniors deserve care that prioritizes